Hi everyone, my name is Tyler Hollmig. I'm Director of Dermatologic Surgery at Ascension Seton and also at UT. I'm so excited to have the opportunity to partner with Milk and Honey as they launch their medical spa practice and really dedicated to helping them do that in a way that I consider the right way, which is by practicing safe and effective medicine. I'm really looking forward to hearing questions from you all and happy to answer those. I have a few in front of me today and a couple of topics that I want to discuss, and I hope that you all will find these really helpful. I just thought it might be helpful to talk a little bit more about combined treatments. In my own practice, these are very popular, especially during COVID. This is sort of a time where some of my patients have the opportunity to have some downtime, and the rest of us are all wearing masks. So if we're a little bit red, a little bit swollen for a few days, it's not too big of a deal. I really like combined therapies because I feel like we can hit multiple targets, whether that's sun damage or redness, wrinkles, volume depletion, hit multiple targets at one time. And when we do that, the overall gestalt of our appearance, the subjective sort of way we interpret each other's faces, we can really move the needle there and give patients what I think is a really remarkable amount of improvement safely with the convenience of a single session. And it goes without saying that our world is busier than ever, and many of us are juggling, work. Maybe we have kids at home. We sure do here, where my poor wife works a full-time job, and then she's also, a school teacher, a principal, a janitor, and kind of does everything at once. So offering patients a single treatment session, I think, can be really helpful. It's not for everyone, but it's for some people. Now, I will say that this needs to be done thoughtfully, because when we do combine treatments and multiple different things at once, we also have an increased risk of side effects unless we're really thoughtful. And that's something that I am dedicated to in my practice and certainly in training folks at Milk and Honey as well. I love combination therapies with laser and light devices when we hit multiple separate targets. It seems like you can kind of get in trouble if you hit the same thing. So if we're trying to do wrinkle, wrinkle, wrinkle with 3 devices, we might put too much heat into the skin or otherwise have a little bit of a higher risk of complications than if we try to hit multiple targets. And here's what I mean. If someone comes in with sun damage and fine lines, we can do a treatment like BBL, broadband light, which does wonders for sun damage. And at the same treatment session, use another laser, Moxie, is wonderful at treating fine lines and targeting collagen growth. And when we have multiple different targets, it is safer in terms of not hitting the same thing and causing too much heat absorption into the skin or other potential risk of side effects or even causing pain. So I love doing that. I'll often combine some of these devices with injectables such as neurotoxins like Xeomin or Botox, Dysport or others, and fillers. And again, if done thoughtfully and done in the right order, these can provide patients with really nice improvement at a single visit. So that's something that I enjoy doing and I think provides a really nice benefit for our busy patients as well.